Welcome back. Let's apply what we learned in the previous lecture. Let's look at a real type example to illustrate Munchausen syndrome. Picture a 28-year-old female patient who has been transported by your EMS unit multiple times for severe infections. Each time she has a high fever, low blood pressure, she looks septic. You rush her to the hospital, she gets IV antibiotics. But weirdly, no source of infection is ever found. Blood cultures grow strange bacteria that don't make sense, or her symptoms improve too quickly. This happened over and over. What was going on? It turned out she was injecting contaminated substances into her own IV line to cause infections. Essentially, she was giving herself sepsis. Why? To get attention, to be in the ICU, to have people care for her. In her mind, it fulfilled an emotional need. For EMS, this case was tough. Every time we saw her, she really did look sick, because she was. She made herself sick. The diagnostic challenge was figuring out why a young, healthy person kept getting these bizarre infections. Eventually, one doctor noticed that some of the bacteria in her blood were commonly found in dirt and not typically seen in hospital acquired infections, which raised suspicion. With further investigation, they discovered her actions. When confronted, she denied doing anything intentionally. That denial is common. She was suffering from factitious disorder. The takeaway for us is that even in a case like this, our job was to treat what's in front of us. We gave her the benefit of the doubt each time and provided standard sepsis care. That's appropriate because you can't assume someone is faking if there's any chance it's real. But we also documented each incident thoroughly. Over time, the pattern and documentation helped reveal the truth. This patient eventually received psychiatric help, but it was a long road. It shows how extreme Munchausen syndrome can get, willing to risk death via septic shock just to be cared for. It's tragic, but it underscores the importance of being alert to unusual patterns. Now, an example of Munchausen by proxy. A 5-year-old boy had a history of frequent medical crises. Paramedics were called multiple times for him having seizures at home. Sometimes he'd also arrive at the ER with sky-high sodium levels. I'm talking levels that were life-threatening. Each time, doctors were puzzled. There was no clear metabolic disorder to explain it. The mother was always very involved, very calm, and insistent that something was terribly wrong with her son. She carried a thick binder of his medical history and spoke in very medical terms to the staff. This went on for quite a while. Seizure episodes, sodium spikes, various other unexplained symptoms. The child went through numerous tests and even surgeries. He had a feeding tube placed, for instance, due to these issues. Finally, the pattern and some specific lab anomalies led providers to suspect the mother was inducing the illness. They contacted Child Protective Services and law enforcement. Under investigation, it was discovered that the mother had been secretly administering salt in toxic amounts through the boy's feeding tube to create those high sodium readings and seizures. This is why nothing made sense medically. It was being caused externally. Heartbreakingly, the boy did not survive. He died from one of these episodes. The mother was later convicted of murder for what she did. This is an extreme case, but it exemplifies Munchausen by proxy. For EMS folks, what could we glean from such a case? If you had been one of the paramedics responding, you might have noticed that every time it was the mom who found the child seizing, and maybe the child seemed oddly fine in your presence. Perhaps you note that the mom was not as panicked as you'd expect, or conversely, she was overly composed. Maybe your report mentions no seizure activity witnessed by EMS, patient alert upon arrival. Those observations are crucial. In this case, it took a while before anyone put the puzzle together, but eventually, the consistency of detailed medical records, including EMS reports, helped expose the lie. The key point: if something feels off, trust that feeling enough to document everything and quietly alert the hospital. You might literally save a life by doing so, as getting authorities involved can remove a child from a dangerous situation. Now let's talk about how to manage these situations in the field. First and foremost, treat what you see. Even if you suspect a patient is faking, you must address any possible real medical issue. Follow your protocols for the symptoms presented. For example, if they say they're having chest pain, go ahead and do the full chest pain assessment, EKG, etc. If a child is reported to have a seizure, perform your seizure management. You cannot withhold care on a hunch. Our responsibility is to rule out the life-threatening stuff. Many factitious disorder patients do a good job making themselves look very ill, and indeed they might have made themselves physically ill, like by taking a bunch of pills. They need treatment for those actual effects. So we always err on the side of providing care. While doing that, stay objective and observant. Rely on your own assessment. Sometimes these patients give very dramatic histories. It's easy to get caught up in their story, but always do your primary survey. Get your own vital signs and see if things add up. For instance, patient claims, "I've been vomiting all day and I'm so dehydrated I can't stand," but their skin is normal, pulse is normal, and you notice they are able to chug water when they think you're not looking, things like that. Take mental note. Treat what needs treating, maybe start an IV for safety, but observe closely. Another crucial point: don't confront the patient or caregiver on scene. Even if you are pretty sure this is factitious, accusing them can make the situation worse. They will likely become defensive or flee from care entirely. Also, it could create a volatile scene, especially in a by proxy case. If a parent feels accused of hurting their child, that could escalate quickly. Our goal is to keep everyone safe and get the patient to the hospital. So maintain your professionalism and empathy. You might be thinking internally, something isn't right here, but outwardly, you continue to be supportive. We're going to take good care of you, etc. At the same time, you can be strategic. In a suspected proxy case, if possible, try to have another set of eyes on the caregiver or have them right up front instead of with the child. For instance, you might ask a second EMT or a police officer to accompany the parent separately as per policy, or simply have one provider focus on the child while another engages the caregiver. This isn't always possible, but separating them even slightly might protect the patient during transport. Also, carefully secure any IV lines or ports if you suspect tampering. You don't want the caregiver injecting something en route. These are just considerations. Remember, your safety and the patient's safety come first. So, in summary for management, treat earnestly, observe quietly, don't jump to accusation, and keep your antenna up for anything that doesn't fit. To wrap up, remember that factitious disorders, while rare, can have serious consequences. Patients with Munchausen syndrome can hurt themselves badly, and those with Munchausen by proxy can gravely harm or even kill their victims. As EMS providers, we might catch the first clues because we see these patients in their home environment and often see repeat patterns. Keep those red flags in mind: inconsistent stories, symptoms that don't match exam, extensive medical histories, very unusual caregiver behaviors, etc. If you spot these, it should put you on alert to quietly gather as much objective info as you can. Always maintain compassion and professionalism. It can be challenging. You might feel annoyed if you realize someone wasted resources by faking an illness. But these folks are dealing with mental illness. Especially in proxy cases, an innocent child is involved who absolutely deserves our utmost care and protection. So we treat the patient with empathy as we would any other, and we handle the investigative side through the proper channels afterward. Communication is crucial. Tell the receiving facility what they need to know in order to protect the patient. A private comment to the charge nurse or doctor can set in motion the process to get a psych consult or notify authorities. Don't try to solve it all yourself on scene. Our job is not to play detective or accuse, but we are the eyes and ears in the field. Finally, by being vigilant and thorough, you truly can break the cycle for these patients. For someone with Munchausen, getting caught might be the first step towards psychiatric help. For a child suffering abuse, your actions could literally save their life. So, stay alert for the unusual, trust your assessments, and always, always document diligently. In EMS, we say, if it's not documented, it didn't happen. In these cases, if it is documented, it might not happen again to that patient. Remain calm, objective, and supportive, and you'll do right by the patient even in the tricky scenario of factitious disorders. Thank you for your attention.